We have nearly 150 active volunteers. Our volunteers are truly the backbone of this organization. Many of them have significant years of experience. They are the initial contact for patients and visitors and really set the tone for the overall experience at South County Health.
I became interested in volunteering as a result of my sister. My sister was a ER nurse for 25 years, and I was approaching retirement. She suggested emergency room volunteering. The rest is history, and I'm in my 11th year and love it.
Many of them have significant years of experience. They are at that initial point of contact from admission to discharge. They are involved in every step of the patient's journey. They really open the interaction and close the interaction, and they do an incredible job as ambassadors for the organization.
My post is escort services. So if somebody's coming in to have, say, a procedure that lasts a few hours, I will be one of the people that escorts them to the waiting room and gets them started on their journey through their day of surgery or whatever other treatment they have to have. And then when they're finished, that's when I'm called upon to wheel them out to their cars if they've had general anesthesia.
It's very gratifying. This is a way for me to give back to the community. As people come to the hospital, most people are not coming to the hospital because they feel good. Most people are in discomfort or coming in for a procedure. And so as I'm walking them from the main lobby into the surgical suite, I'm able to ask them if they've had a procedure before, explain to them what to expect. My goal in those situations is to have them feel more comfortable by the time we get to the waiting room in that short 90-second walk that we have.
I think one of my gifts is helping people feel at ease. I am taking them down to something that's maybe making them nervous, and then, of course, I try to tell them what the weather's like when this whole thing's over.
Volunteer services can have a profound impact on the overall experience of patients and visitors, and really staff. We are working in a very lean healthcare environment, and they offer up an opportunity for expansion of services. Not necessarily clinical tasks, but they can do non-clinical tasks and those things that can support the clinical team. And that additional support is really invaluable.
I feel what sets apart South County Hospital from other organizations is the end-to-end experience that people do receive from the time they walk in. Certain days they're going to hear piano music, they're going to be greeted by a volunteer, they're going to be signed in a friendly manner, walk down to the surgery area with a nice friendly chat on the way, and then they're going to be met by the nursing staff who are incredibly friendly, and we hear about how wonderful the nurses are as we're wheeling them out after the procedures, and we bring them all the way out to their cars.
I love working with the people that I work with. I love working with the patients that I interact with. So I feel like I've gained a lot of new friends since I've come to work here.
We're always looking for volunteers, and I would say we are looking for those team members that actually have aligned values. So we're looking for people that are empathetic, that are active listeners, that are willing to put themselves in a place of service. We have high school volunteers, we have baby boomers, we have Gen X. We recruit pretty much anyone in those age groups, and obviously we're going to give them an age-appropriate assignment.
We're tops in the state for many, many years in patient experience and patient satisfaction. The hospital's very focused on that. We fill in the cracks and make the total patient experience what it is today.
We do also ensure when we are interviewing our volunteers that we understand what they're passionate about. We try to align what their interests are to the area that they're going to be deployed to. That's really what differentiates our volunteer group in South County Health from other health systems.
Nurses, orderlies, people in the cafeteria, everybody in this hospital is very supportive of the volunteers.
If somebody asked me about volunteering here, it would be easy. I would say do it. You're going to get more out of it than you're going to put into it. That was the biggest surprise for me. I thought I would volunteer a few days a week into the community, and what I've gotten out of it is much more than that. So I would simply say do it.
The volunteers are very much integrated into everything that we do. The CEO sometimes refers to them as our secret sauce. They have unique and very intentional interactions with the public and are fantastic ambassadors for us.